Okay, I'm back. Had my PRP injections today. Um, I had 3 of them. I had 2 on the inside of the knee, and I had 1 on the outside of my left knee. Um, the first one was the most uncomfortable. It wasn't painful, but it was a lot of discomfort. Imagine them sticking a needle in the joint, and that's, and then even the act of squirting the platelets in there even it was a weird feeling, something I really didn't enjoy, but it had to be done. So did that one. The second one really didn't feel. That one was higher up. The lower one was right on the where the tear was on the meniscus, and then the other one was a little bit higher up on the inside, and then that was also on the other tear. And then she shot me on the inside, and that one wasn't as bad as the first shot, but it was still uncomfortable. It was a weird feeling, and it was really uncomfortable. Didn't like it at all, but had to be done. So what I was saying in the last video was about the leggings I wear. This is the ones I was talking about that keep your muscles warm so you don't pull muscles and stuff like that. Also helps if you dive or slide or whatever like that it doesn't tear up your legs or your knees that bad. So I wore that underneath my sweatpants that I wore that day, and then the brace over the top of that. So anyways, back to the PRP. So when I got done, I didn't have no pain or nothing like that. Walked out of the office just fine. I don't have much pain when I'm walking and stuff like that, not even really any discomfort. If I step the wrong way or something like that, if I lean the wrong way or torque it the wrong way, then yeah, I'll feel it. But just like a straight walk and stuff like that, I'm fine. You can't even notice that anything's wrong with my leg. But it's the shifting of the weight and uneven surface and stuff like that, I've got to be careful. So when I left the office, about 5 minutes after I got the shot, there was swelling in the joint. And you will have swelling in the joint because that's showing that the platelets are working. That's why they tell you not to take any anti-inflammatories, ibuprofen, naproxen, and aspirin a week before you're going to get your shots, because those actually inhibit platelets from working. So the platelets cause swelling and heat, and that's what's regenerating the cartilage, what's healing the joint. So if you take that, then it's going to cause the platelets not to work so well. So what's the point of getting the shots if you don't? So anyways, I played on Saturday. I usually take 1-800 early in the morning, and then that's all I take all day. I didn't take that. I played without it. And the whole week, I didn't. The only time I take ibuprofen is when I play. I just take one, and it helps with stiffness and soreness and stuff. So I didn't take that. So I played all 4 games without that. Then today went in, and I felt fine. I was just, my legs were a little bit sore, hip flexors and stuff like that, because I hadn't played in a while and hadn't done that much running because I've been totally laying off. Just training my legs in the gym is all I've been doing, just straight pushes, not anything to the side. So I got done about 5 minutes, felt a little swelling in the joint, but that's normal. It felt tight, and that's what swelling feels like in your joint. Your joint feels tight, and it doesn't move. Your range of motion is cut down a little bit. It wasn't a lot, but it was some. So she told me that was already going to happen. Even the stuff that I read, all the material I read said that was going to happen. And they tell you can take extra strength Tylenol, and they want you to put a heating pad on it. And the heating pad, instead of a cold compress, they don't want no ice on it because ice reduces inflammation. And they want it to inflame because those are the platelets that are working. So it's actually opposite of what you would think. After you get done playing, you want to ice your knees because you want to reduce the swelling. This actually you want to, because those are actually the platelets working to repair what's damaged. So I got a heating pad and wrapped it in a heating pad, and it said, put it on there for 3 minutes and then take it off, put it on for a few minutes and take it off. So it's kind of just like ice. It's the same thing. We're 20 minutes on, off, 20 minutes on, off. And so I did that, and really, it hasn't hurt at all. I even worked a full shift today, 10 hours. Um, um, I'm a foreman now, so I'm not doing the work per se, but I'm doing a lot of walking, a lot of uneven surfaces, a lot of going and looking at jobs and stuff like that. So I do have to watch my step. But I did wear my brace for about nine hours of the 10 hours of shift. I just took it off for a little while to let it loosen up a little bit. Then I put it right back on the last hour of the day. So I wore it for 9 hours to 10 hours, and actually with this underneath and with the pants over the top, and then I put the brace on the outside, it didn't hurt my shin like it did without it that day. So I think I found something. All I need something is like a little bit more cushion on the bottom. Like I said, maybe a small gel pack, or even like like a cushion or something like that on my shin. I think it'll be fine. So that was good. I came home. There's actually no swelling in the joint at all. I can move it just like the other one. I even took a picture of it, and I don't see really any swelling involved, and it's not in the joint, so I have full flexion of the joint also. Today I didn't feel no pain. Like I said, I wore the brace. She said to wear the brace because, like I said before, it's going to space out on the other side, so it's going to give more room also for the platelets to work. So it's not going to be smashed in there. It's going to give more room for the platelets to work. So I did wear the brace pretty much 9 out of 10 hours, and wore it home also. So far so good. Like I said, I probably won't notice anything for maybe 2, maybe 3 weeks. She said I can't play softball for 3 weeks. So 3 weeks from today, I can't play softball. So, and then she said I can start training my legs 2 weeks from today. So I can start doing that, but I can only do like half the reps I was doing before, or 75% of the reps and 75% of the weight. So I can't go full out. That, and I have exercises to do like side lunges and stuff like that, and hour lunges where you go forward, all the way around on all the quarter of the hour. Do those on my legs too, and then that also helps strengthen the tendons and stuff like that, because those are not the muscles you usually work. And then I can also use the Helix side lateral trainer that I have, which is moves like this, which works your hip flexors and your groin, which is also going to work also on the MCL and the LCL and the ACL. So. And it'll also help, get blood flow into the meniscus and help that heal also. So looking forward to this for a while now. Finally got it done. And all I have is, you can see where the 3 needle marks are, but no bruising or anything like that. And everything went well. So she really knew what she was doing. Like I said, they use an ultrasound on your knee, and that's how they place. They mark it with an X, almost like a plastic surgeon would do, an X with a marker on your leg, so they know where. And then they palpate it with their finger, knowing where to go in with the needle. Then they go in there, use the ultrasound, and guide the needle right into where they want to shoot it. And she actually has a picture where she took a picture with the ultrasound up above, and then she has the one comparing it below where it's going in, and she knows exactly where to go. So she pinpoints, she puts a little arrow on there when she takes a picture. So like I said, everything went well, and so I probably won't do another video unless it really starts feeling good or bad until around 2 weeks, I think. When I probably do my first leg workout, and then, unless, like I said, unless I see some dramatic change or something like that, then I'll do another video. But so far so good, and I'll keep you updated. So it was $250 for the office visit, and it was $1,200, and that was for all 3 shots. That was just one visit. It wasn't $1,200 per shot. It was $1,200 for all the shots. So she pulled 10 cc's, and with the platelets, she did 3 different shots with the platelets. So that's pretty much all I have to tell you right now. And then, like I said, unless there's some big change, I'll make another video probably in 2 weeks when I do my first leg workout, and I'll let you guys know how it is. But so far, so good. So stay tuned.